Hemophilia. Hemophilia is a rare disorder where your body lacks enough blood clotting proteins, causing the body to bleed more than normal. To prevent excessive bleeding, this is what a blood clot and a normal body looks like. Unfortunately, when you are born with hemophilia, this is what your cells look like after suffering from an injury, causing you to bleed excessively. Hemophilia can be inherited, but 30% of people with hemophilia have no family history of this disorder. Everyone has two sex chromosomes, one from each parent. A female inherits an X chromosome from her mother and an X chromosome from her father. A male inherits an X chromosome from his mother and a Y chromosome from his father. Two types of hemophilia is hemophilia A and hemophilia B. Both are located on the X chromosome. Hemophilia A or B are mainly passed from father to son. Hemophilia A or B may also be passed from a mother to a son. Women with the hemophilia gene are just carriers and never show any of the hemophilia symptoms. Unlike hemophilia A and B, there is a thing called hemophilia C, which is inherited from both parents and can be given to boys and girls. People with hemophilia experience unexplained and excessive bleeding from cuts or injuries or after surgery or dental work, many large or deep bruises, unusual bleeding after vaccinations, pain, swelling, or tightness in your joints, blood in your urine or stool, and nosebleeds without a known cause. People with hemophilia need to be extra careful. If they experience any of these symptoms, they must be rushed to the hospital. This includes things such as sudden pain, swelling, and warmth in large joints, bleeding from an injury, especially if you have a severe form of hemophilia, painful prolonged headaches, repeated vomiting, extreme fatigue, neck pain, and double vision. Studies show that 1 in every 5,000 males are affected. Each year, 400 babies are affected by hemophilia. As of 2016, hemophilia is not curable. One of the treatments for hemophilia is the at-home clotting infusions. These can help prevent bleeding and will also stop you from experiencing all of the hemophilia symptoms such as damage to the joint. Other treatments include getting the hepatitis A and B shot. You can also take medications such as clot-preventing medications and fibrin sealants. Also, people who experience damaged joints may go to physical therapy to help them heal again. If you are pregnant and want to see if your fetus is affected by hemophilia, there are tests that you can get done. You can be diagnosed with hemophilia from the ages of 9 months to the age of 2 years old. But some people who only have a mild case of hemophilia do not get diagnosed until they undergo surgery and personally experience the actual excessive bleeding. Hope you learned a lot about hemophilia. Thanks for watching.
Clot formation involves, among others, platelets and coagulation factors. The platelets are first to arrive at the scene and begin to loosely cover the injury. Thrombin enhances the activation and aggregation of platelets. On their surfaces, the coagulation factors, also activated by thrombin, accumulate. In tandem with 5A, factor 10A induces the so-called thrombin burst. Finally, thrombin converts fibrinogen into fibrin that then forms fibers, cross-linked through the action of factor 13. This stabilizes the developing clot. In patients suffering from hemophilia, the propagation phase of clotting is disrupted. As a result, they cannot generate thrombin in sufficient amounts to induce normal clotting.